Hello everyone and welcome to another edition of For the Health of It. I'm your host, Lou Beccaria. Thanks for being with us. Today we'll be covering the topic of women's maternity health care. Our guest to discuss this important topic is Jennifer Brosnan, the director of Phoenixville Hospital's Women's Health Pavilion. Jennifer, welcome to the show. Thanks for being with us.
Thanks for having me.
We have been wanting to cover this topic for a while. So before we start, tell us a little bit about your own background.
When I first started nursing, I was a telemetry nurse for a couple months at Riddle Memorial Hospital, which is in Delaware County. And then I went down to Atlantic City because I wanted to be a labor and delivery nurse. So I went down to Atlantic Care, and I was there for about 3 years and gained some really good experience. And then I really was into the care of midwives. So I wanted to move back home, which is in Delaware County, and I came back home and I started working at the birth center. It's now called Life Cycle Woman Care in Bryn Mawr, and that's where I remained for 12 years. And I really developed my skills as a nurse and as a leader and became very experienced with birth, natural birth.
Wow. What was it, of all the specialties that you could have had in healthcare, what was it that attracted you to this particular one, Jennifer?
I always loved moms and babies. From the time I was 3 years old, I knew this is what I wanted to do. I made little books saying, when I grow up, I want to be a baby nurse. And so I've always been obsessed with moms and babies and babysat. And I am all my friends' baby person. I love to help them and all families with new babies.
Mm-hmm. Great. Well, in the introduction, I made reference to the Women's Health Pavilion. So tell us what that is all about.
So Phoenixville Women's Health Pavilion, it's comprised of labor and delivery. We have a 5-bed labor and delivery facility, and then a postpartum floor, which is after you have your baby, you go and stay. We have 14 rooms there. We also have a nursery and a NICU.
Okay. And what do those postpartum rooms do? What do you do there?
So when you come in, you're going to have your baby. You're going to go to the labor side. You have your baby, and after about 2 hours after you have your baby, you're going to go to the postpartum and maternity side, and that's where you're going to stay for a few days afterwards as you heal and to learn how to take care of yourself at home and your baby at home. And so you stay there, you spend the night, and the baby stays with you in your room, and the nurses come in and give you education and help you learn whatever you need to learn for your home.
Yeah. One of the things that I've heard as a male, I've heard that sometimes women have depression after they give birth. It's such a happy occasion. Why would that happen? So
after you have birth, you go through a series of hormonal changes, and it's a very common thing that happens. So 3 out of 4 women may experience feeling sad or lonely after birth. And you can actually develop postpartum depression anywhere in the first year after the baby is born. It's more common in the first couple of months, but anywhere in the first year you can develop it.
Wow.
So feeling sad and alone.
That's really interesting. Even if there's family support around and so forth, and a husband in the picture. Wow. What are some of the types of birthing options that you offer at the hospital now?
Right. So birth looks different for everybody. Sometimes your body naturally goes into labor on its own. Sometimes you have to be induced. Sometimes it's too early to have a baby. So it really looks different for everybody. We encourage women to know about birth options and what they might think that they want their birth to look like. But they can come in. We have peanut balls. We have birthing balls.
What are they, for the benefit of our audience?
So they're tools to help you open your pelvis and to help the baby come down and to help birth your baby. We try to encourage vaginal births. Sometimes there's a need for a cesarean section, but we really try to go for that.
What are some of the reasons why a cesarean birth may be necessary rather than the usual vaginal?
Right, so sometimes the baby just doesn't want to come out. The cervix doesn't dilate, or the baby's heart rate goes down, or it's a repeat C-section is what we call it, and the mom doesn't want to trial labor.
Okay. Is it more serious if a woman has, let's say she's having her second or third child, Is it more serious if to get a cesarean birth if she's already had a cesarean? In other words, is there some kind of limit as to how many cesareans you could have?
There's not a limit, but with more C-sections comes more risk to the mother. That's abdominal surgery, so you have an increased risk of bleeding. So we always give the option of trying to have a vaginal birth after a cesarean section, which is called a VBAC. Okay. So they'll do a trial labor run of that, and the physician's there. And if it goes according to plan, then great, we'll have a vaginal birth. If not, we have an OR and they can have another C-section.
C-section, okay, great. Well, we're going to take a break, Jennifer, for commercial right now, but thank you very much. It's been very informative. We are going to hear a word from our sponsors, folks, and when we come back, we're going to hear more from Jennifer Brosnan, the director of the Phoenixville Hospital Women's Health Pavilion. Please stay with us. Welcome back to For the Health of It, everyone. We are talking with Jennifer Brosnan, who is the director of the Phoenixville Hospital's Women's Health Pavilion. And Jennifer, in the first portion of the show, you really gave us some really great information. So if you could tell us now, who are members of the team that makes up the pavilion, the Women's Health Pavilion, and what are their specialties and what exactly do they do in this whole birthing process? So
the physicians we work for, Valley Forge OB, they're the delivering docs that we work with, and then we also work with pediatricians and neonatologists. So they're a part of our birthing team, per se, of specialists.
And what is their role individually with those people who make up the team?
Valley Forge, they're the OB doc, so they're going to come in and do the delivery for you and take care of anything prenatally, and after you have the baby, they come see you in the hospital, and then you come in for postpartum, that means after birth, checks with them. Okay.
Prior to having the baby, during the pregnancy, what is the recommended period of time to have the pre-birth visits, and what exactly does the OBGYN doctor do during that period?
So the woman and her family establish care with the OB early on, anywhere from 8 weeks on, and they start their visits. They do it monthly and then weekly as they grow and get closer to delivery.
Okay.
And it really looks different for everybody depending on the severity. If there's any issues, complications, they need to come in for NSTs, or they have any other sort of comorbidities going on that they need to be seen more for.
What are the typical things that a doctor, the OBGYN doctor, is looking for during the pre-birth period, for a well
that the
pregnancy?
Baby's growing well and the mom is gaining enough weight and not too much weight, making sure mom and baby are healthy and
Jennifer, what's considered the proper amount of weight for a woman to gain during pregnancy?
So it depends. It really depends on their starting weight.
Okay.
Generally, it's probably around 30 pounds. Sometimes it's more than that.
Okay. Does it differ? This may seem like a stupid question, but does it differ between if it's a boy they're having or a girl? No.
No, it matters on what the mom's starting weight was. Sometimes they don't really need to gain any weight.
All right. Wow. Okay. So afterwards, after the baby is born, and so what is the postpartum care consist of?
At the hospital?
No, with the visits to the doctor.
So that generally ends, and they will go back and see their physician 6 weeks to make sure that they've healed completely and everything's okay.
Okay, great.
Once they had a C-section, they'll come in earlier.
Okay, and just to make sure that it's healing properly. I understand that there's a relationship that the Women's Health Pavilion has with the DuPont Nemours physicians. What is that all about?
It's a very collaborative relationship. Dr. Rahman is the director of Nemours, and her and I work very closely together to provide education for my nurses and to look at our program and for our NICU moms and babies, make sure that we are providing the best care we can and have the best outreach for them and programs.
Is the Nemours Center considered like a kind of a national center of excellence for this kind of thing?
It is. It's great. One of the things that we're working on is called Bright Start. It's reading to the babies. So we had a bunch of training for the nurses on how there is actually a way that you read to the newborns.
Really? Mm-hmm. And how was that?
Great. We have volunteers that come to our NICU. They're baby rockers. So if you ever have any spare time, you want to come volunteer, you can come hold our babies.
Wow.
Yeah. And read to them.
I mean, in your experience, do they have men doing this as well as
Sure.
women? Really?
I had somebody reach out to me and says, I'm a grandfather and I just moved here and I'd like to volunteer. And so I set him up and gave him the information how to do that.
Wow. Awesome. I'd like to go back into the history of women's health care a little bit. Why is there so much emphasis now in 2019, for example, and over the last 15, 20 years of women's health care as a specialty versus years ago? How has the field of medicine and health care grown to that effect, and why?
I think that we have grown in that we have realized that more isn't necessarily best, that compared to our counterparts in the world, our mortality rate is extremely high, and we need to do more to lower that. And what contributes to that is your C-section rate. Having C-sections aren't necessarily the best option in every case in a healthy woman. And a straight vaginal birth is the best thing in most cases to occur. Also, our infant rate, mortality rate is high compared to other countries. And so it's really our duty to look into that and to see what other countries are doing and try to implement that here.
Yeah. Do you have any insight, Jennifer, into why the other countries seem to have better results, better birthing rates, less morbidity, and so forth?
I think that if you leave the couplet alone to do what's natural, you have better outcomes. I think that when we start with interventions and thinking that, okay, we need to break your water or do exam, we need to take a step back and let the body do what it's naturally made to do within reason, because there are instances where we need to intervene.
Wow. So just let nature do it, do
Right.
its job, and
Right.
don't intervene so much.
So some things include inducing at 39 weeks. So, instead of just letting the woman and her body allow that space to go into labor on her own and to naturally have the baby on her own without, doing procedures such as breaking her water or starting Pitocin when it's not naturally ready to go and do that.
Good. Before we break for a commercial again, I'd just like to ask you, what do you like best about your job? Why do you do it?
I do it because I know that I'm in a position to make change, and the community, my community, Phoenixville's community, we deserve better and we deserve more, and I'm in a position where I can do that for them.
Wow. Great. It's always a wonderful feeling to know that you're making a difference in the world.
Sir.
Yeah. Well, my guest is Jennifer Brosnan, who is the director of the Phoenixville Hospital's Women's Health Pavilion. We're going to hear more from Jennifer when we come back with the third segment, so please stay with us. We're going to hear a word from our sponsor right now. Hi, welcome back to For the Health of It. For those of you who are tuning in just for the first time, I'm the host, Lou Beccaria, and we have the pleasure today of talking with Jennifer Brosnan, who is the director of the Phoenixville Hospital Women's Health Pavilion. And it's been a fascinating show so far with all the information that you've been giving, Jennifer. So let's open up with what's the single one or two things that a woman could do to make sure that she's healthy enough to have a baby?
So a woman really needs to make sure she's eating healthy, drink enough water, make sure she goes to get prenatal care, take her prenatal vitamins. Yoga is a very good exercise, especially as she gets further along with her pregnancy. It helps her with remaining calm and breathing techniques and flexibility.
Yeah. I know you often hear it's common sense now, but women aren't supposed to drink during pregnancy, drink alcoholic beverages and so forth, and obviously not take drugs. What are the effects if women were to do those kinds of things on the fetus?
So the recommendation is not to drink any alcohol at all. The babies from drugs and alcohol, it's aftermath. The babies can have tremors, especially United States has a big issue now with they call the neonatal abstinence syndrome babies, NAS babies. And so after a woman who is using drugs has a baby, sometimes the babies develop jitteriness, and they're extremely fussy, and they often, in our institution, will go to the NICU, and sometimes they're treated with medicines to help them cope with that and to withdraw from whatever mother was using in pregnancy.
Jennifer, where do you see the Women's Health Pavilion going in the next 5-10 years? I mean, what more could be done to develop it?
I see us growing in the classes that we offer, prenatal classes. I see us growing in our lactation, which is the breastfeeding area, offering more support classes and education classes. I see us as a facility growing with providers, adding some midwives to the practice.
Okay. Do you see that your team that you described earlier being composed of more people, more specialties, and growing in that way?
I do. I see us growing. I'd like to see more OT and PT services for our newborns. I'd like to see that grow, that department.
Okay, great. For the benefit of our audience, maybe you could mention if somebody had questions and so forth, they'd like to contact you. How can they get a hold of you with your email, with your phone number, the website?
Yeah, so you can email me at jennifer.brosnan@towerhealth.org.
Okay. Anything more that you'd like to leave our audience with as tips? I know you've given some of them already for healthy pregnancies. So
just know your options, know your body, know about birth, and always ask questions. Don't ever be afraid to ask a question. It's your body and your baby and your birth.
Yeah, okay. You mentioned also at the very, very beginning about midwifery. You were
Midwifery.
Midwifery. Can you tell us what that's about?
So midwifery means with women, and they are nurses with an advanced degree, and they work in conjunction with our docs, and they have a different philosophy of care and birthing. So there are birth centers, there are home births, there's hospital births, and
is that becoming more in vogue now than it was before?
yeah, well, they've always been around. Midwives have always been here. Their role throughout the years and the reputation, I guess you could say, has looked different. I know my 97-year-old grandmom had said that, a midwife, she's from South Philly, that when she heard of a midwife, it was when it was an unplanned pregnancy and the midwife would come to your house and it was all hush-hush and a negative thing. So, but it's not a negative thing. It's a very positive thing. They're very in tune with the women that they take care of and their families and look at the situation as a whole.
Do you see it growing in popularity as the years come
I do.
by? Yeah.
I do.
Okay. All right. Well, thanks, Jennifer, for being with us. We really appreciate it. And thanks for imparting the information that you have. It's been great having you on the show.
Thank you.
Yeah. Well, folks, we wish we had more time, but that's about all the time we have for today's show. I'd like to thank once again Jennifer Brosnan, the director of the Women's Health Pavilion at the Phoenixville Hospital, Tower Health. We hope that you've now consider yourself a little bit more informed about this important healthcare services of women's health at the Phoenixville Hospital. This is very valuable information to have, obviously. Until we meet again for another For the Health of It show, I'm Lou Beccaria. It's been my pleasure to be your host as always. And remember, folks, if you're healthy, you're wealthy. We'll see you next time.